Welcome to the deep dive. Today we're tackling a subject that might hit close to home for many of you, especially if you're a dog owner: canine lymphoma.
Yes, it's surprisingly
Okay,
common,
no,
isn't it? And, well, it can be quite complex.
exactly. So we've gone through the source material, canine lymphoma, basics, diagnosis, and treatment to sort of pull out the essentials for you.
Right. Our aim here is really to give you a clear, concise, but also engaging overview. We want to cover what it is, the different forms it takes, the signs you might see.
How vets diagnose it, and of course the treatment options.
Precisely. So you can get a solid handle on it without, drowning in technical detail.
And just to highlight how common this is, get this. Canine lymphoma can make up almost a quarter up to 24% of all cancers in dogs.
That's huge. And if you look just at blood-related cancers, it's the vast majority, something like 83%.
Staggering, really. Okay, so with that context, let's dive in. Fundamentally, what is canine lymphoma?
Okay, so at its core, lymphoma involves lymphocytes. These are specific white blood cells.
Part of the immune system normally.
Exactly.
Yeah.
But in lymphoma, you get what's called clonal proliferation.
Yeah.
Basically, one abnormal lymphocyte starts making endless copies of itself.
Okay.
This typically happens first in the lymph nodes, causing them to enlarge. You might feel them swell up.
Right.
But, and this is crucial, lymphoma isn't just stuck there. It's usually a systemic disease.
Meaning it can spread.
Yes, exactly. Think of it like roots spreading. It can potentially move into the bone marrow, the blood, even the central nervous system and other organs.
So definitely not just a localized lump we're talking about.
Not usually, no.
Yeah.
And we mainly categorize it based on which type of lymphocyte goes wrong. B cells or T cells.
Ah, the B cell versus T cell distinction.
Right. B cell lymphoma is more common, maybe around 75% of cases. T cell makes up the other 25% or so.
Okay.
And there's an interesting clinical link here. T cell lymphoma is often associated with hypercalcemia.
High calcium levels in the blood.
Yes. So that high calcium can sometimes be a bit of a red flag pointing towards T cell.
Huh. Interesting connection. Now, are these lymphomas all the same in terms of how aggressive they are?
Oh, not at all. There's quite a range. With T cell lymphoma, for example, specifically the multicentric kind, you can have really aggressive forms.
Like the PTCL-NOS you mentioned.
Exactly. But you can also have much slower growing or indolent types, things like TZL or FL. Those are just technical names pathologists use.
Okay.
B-cell lymphoma, on the other hand, generally tends to be more aggressive.
Right.
But here's the trade-off. The more aggressive lymphomas often respond faster to treatment initially.
Ah, so faster response.
But unfortunately, the remission times, the survival times, tend to be shorter compared to the slower-growing indolent types.
So a quicker response might sound good, but it doesn't necessarily mean longer overall survival. That's important.
It is. It's a key factor in treatment discussions.
Okay, so we've got a better idea of what it is. Let's talk about where it shows up in the dog's body.
The number one spot in about 85% of cases is the lymphatic system itself.
So the lymph nodes.
Yes, often you see generalized lymph node enlargement, the ones you might feel under the jaw, in front of the shoulders, behind the knees. But it can also involve internal lymphatic tissue, like in the spleen or liver, and even the blood and bone marrow.
85% is a lot. What about the other forms?
Well, about 5 to 7% of cases are gastrointestinal lymphoma. That affects the intestines and the lymph nodes nearby.
Okay, digestive system.
Then there's mediastinal lymphoma, maybe 5% of cases. That's in the chest cavity, involving the lymph nodes there, or the thymus gland, or sometimes both.
Right, the mediastinum in the chest. And you also mentioned skin lymphoma.
Yes, cutaneous lymphoma. It's got a couple of main flavors. There are the non-epitheliotropic types. These could be B cell or T cell.
And what do those look like?
You might see things like lumps or nodules, raised patches called plaques, maybe ulcers, hair loss, even changes in skin color, like lighter patches.
Okay. And the other type?
That's called mycosis fungoides. It's a specific type of T cell lymphoma that targets the skin's outer layer, the epidermis.
And how does that present differently?
It often starts quite subtly, maybe just some flaky skin, some itchiness, but then it can progress to thickened red, often ulcerated lesions. It can look quite different.
Sounds quite distinct.
It can be. And then there are even rarer forms, hepatosplenic lymphoma, for instance, where T cells specifically go after the liver and spleen.
Okay.
And very rarely, you can get intravascular lymphoma, where the cancer cells proliferate inside blood vessel walls.
Wow. Okay. So it really can manifest in many different ways. You said it's surprisingly common. What do we know about incidence rates and who's most at risk?
Well, the numbers vary a bit in studies, but estimates range from maybe 20 up to, say, 107 cases per 100,000 dogs each year.
Which ties back to that large percentage of all canine cancers we mentioned earlier.
Exactly. And certain breeds definitely seem to have a higher risk.
Oh, which ones?
Breeds like Boxers, Basset Hounds, Golden Retrievers, St. Bernards, Scotties, Airedales, Bulldogs. They tend to pop up frequently in studies as higher risk.
That's quite a list. Any breeds with lower risk?
Yeah, Dachshunds and Pomeranians are often mentioned as having a lower incidence.
It's fascinating that there are such breed links. Does that give clues about genetics?
Absolutely. It strongly suggests a genetic component, and that's a big area of research, trying to figure out why these breeds are more susceptible. Hopefully, understanding that could lead to better prevention someday.
That would be amazing. Does breed influence the type of lymphoma too, like B-cell versus T-cell?
It seems to. Take Boxers, for example. Reports suggest maybe 85% of their lymphomas are T-cell.
Oh, wow, that high.
Yeah. Whereas in Golden Retrievers, it seems to be closer to a 50-50 split between B-cell and T-cell.
Interesting. And what about age? Is it mostly older dogs?
Historically, the median age at diagnosis has been around 6 to 9 years old. So middle-aged to older dogs, generally.
Okay. So if you're a dog owner, what are the actual signs you might see? What should you look out for?
It really depends heavily on the type of lymphoma, as we've discussed. For the most common type, multicentric.
The one affecting lymph nodes generally.
Right. Some dogs, early on, might seem perfectly fine. No obvious signs.
Yeah.
It happens. But others will show more general signs of being unwell. Maybe they're off their food, lethargic, perhaps vomiting or diarrhea, losing weight, maybe a fever.
Okay, sort of vague feeling poorly signs.
Exactly. And sometimes that increased thirst and urination we talked about, potentially linked to high calcium, especially with T-cell.
Right. What about signs for the other forms, like the GI lymphoma?
With gastrointestinal lymphoma, you're typically looking at digestive signs. Vomiting, diarrhea, poor appetite, weight loss, maybe signs that they're not absorbing nutrients properly.
Makes sense. And the mediastinal one in the chest.
That often causes respiratory issues, difficulty breathing, maybe fluid buildup in the chest, making it harder to breathe, coughing, trouble swallowing. Sometimes a serious thing called K-Vol syndrome, where blood flow back to the heart is obstructed.
Sounds serious. And the skin forms.
Well, as we said, you'd see the skin lesions, the lumps, plaques, ulcers for the non-epitheliotropic type. For mycosis fungoids, that progression from scaling and itching to thicker ulcerated skin. And mycosis fungoids can sometimes affect the mouth too.
Right, and if it affects other specific organs, extranodal lymphoma.
Then the signs relate directly to that organ. If it's in the eye, maybe light sensitivity, redness, inflammation. If it hits the central nervous system, you can see neurological problems, weakness, wobbliness, paralysis, even seizures.
Okay.
And if it's a hepatosplenic liver and spleen, maybe lethargy, poor appetite, weakness, jaundice, which is that yellowing look.
So a huge range of possibilities depending on location. What might a vet actually find during a physical exam?
Well, for multicentric, the classic finding is those enlarged lymph nodes, typically firm, smooth, and usually not painful when touched.
Okay.
The vet might also feel an enlarged liver or spleen when palpating the abdomen.
And then for the GI form?
They might feel thickened loops of intestine, possibly an abdominal mass. Sometimes abnormalities on a rectal exam, or maybe detect fluid in the abdomen.
Okay. What about the chest form, mediastinal?
The dog might clearly be having trouble breathing fast. The vet might hear muffled heart or lung sounds if there's fluid in the chest. And you might see swelling of the head, neck, or front legs due to that pressure in the chest.
Right, that K-Vol syndrome effect again.
Potentially, yes. For skin lymphoma, the vet will see those characteristic lesions we described, the raised areas, maybe red, maybe oozing.
And extranodal.
Again, depends on the site. Eye inflammation, bleeding in the eye, neurological signs like disorientation, weakness, seizures, paralysis. It matches the location.
It really emphasizes how varied this disease can be. Given all that, what do we actually know about what causes lymphoma in dogs? Is it environmental, genetic?
That's the million-dollar question, isn't it? The truth is, it's likely multifactorial, not just one single cause in most cases.
So a combination of things.
Probably. Research points towards several potential factors. There's definitely inherited risk in certain breeds, as we discussed.
Right, the genetic link.
Also, things like chromosome abnormalities, changes in enzyme activity like telomerase, specific genetic mutations, even epigenetic changes how genes are switched on or off.
Okay, complex cellular stuff.
Yeah. And then there's suggestion of links to certain viruses like retroviruses or maybe even Epstein-Barr virus, though that's less clear in dogs than humans.
Right.
And environmental factors are likely playing a role too, though pinning down specifics is hard.
So no single smoking gun, usually. It's a puzzle.
Pretty much. It's an area where much more research is needed.
Okay. So when a vet suspects lymphoma based on the signs and exam, how do they actually confirm the diagnosis? What's the process?
Well, first they need to consider other things that could cause similar signs, right? Enlarged lymph nodes
Mhm.
could be from an infection or another type of cancer or even an immune system issue. So ruling those out, differential diagnosis is step one.
Makes sense. Then what?
Then you move to key diagnostic tools. Basic blood work and a urinalysis are usually done.
What might they show?
You might see anemia, low platelets, white blood cell counts could be high, low, or even normal. In GI lymphoma, protein levels might be low. You might see that high calcium level.
Especially with T cell.
Exactly. And possibly elevated liver or kidney values if those organs are involved. Interestingly, the urinalysis is often normal.
So blood work gives clues. What about seeing inside the body? Imaging.
Oh, imaging is crucial. Chest x-rays are really important. They can show enlarged lymph nodes in the chest, maybe a widened mediastinum, lung changes, fluid.
Okay. And abdominal imaging.
Abdominal ultrasound is incredibly useful. It lets the vet look closely at the abdominal lymph nodes, the liver, the spleen, check for thickened bowel walls in GI cases, look at other organs and see if there's fluid buildup.
So x-rays and ultrasound give you the bigger picture. How do you get the definite confirmation looking at the cells themselves?
Yes, that's the definitive step. Often the first thing is a fine needle aspirate, or FNA.
Sticking a small needle in.
Exactly. Into an enlarged lymph node, usually. It's minimally invasive and can often give a strong suspicion or confirmation of lymphoma based on the cells seen under the microscope.
Okay. Is that always enough?
Not always for full classification. A biopsy taking a small piece of tissue, or sometimes removing a whole lymph node, is generally more accurate. It allows for histopathology.
A more detailed look at the tissue structure.
Right. And it's better for figuring out the exact subtype and grade of the lymphoma. Sometimes, if there are neurological signs, a CSF tap taking spinal fluid might be done. Or a bone marrow aspirate to check for spread there, which also helps with prognosis.
And sometimes an ECG before treatment?
Yes. Checking the heart's rhythm is important before using certain chemo drugs that can potentially affect the heart.
I've also heard about more specialized tests like flow cytometry or PAR.
Yes. Those are really important for nailing down the specific type, especially B cell versus T cell. Immunohistochemistry on the biopsy sample, flow cytometry on an aspirate sample, or PAR testing, they look for specific markers or genetic rearrangements unique to lymphocyte types.
So like CD markers. CD3 for T cells, CD79A for B cells.
Exactly, those kinds of things. They help the pathologist pinpoint the origin, and under the microscope, they're looking for characteristic patterns too, like how the normal structure of the lymph node is wiped out by sheets of abnormal cells in high-grade lymphoma.
Okay, so a multi-step process to get that firm diagnosis and classification. Once you have that, what's next? Understanding how far it spread.
Precisely.
Yeah.
That's staging.
Yeah.
It's absolutely critical for figuring out the prognosis and guiding treatment decisions.
How does the staging work?
It's a 5-stage system based on how widespread the lymphoma is.
Yeah.
Stage I is just one lymph node or region.
Okay.
Stage 2 is multiple lymph nodes, but only on one side of the diaphragm, so either all in the front half or all in the back half. Stage 3 is generalized lymph node involvement front and back.
Got it. What about 5E and V?
Stage 5E means it's spread to involve internal organs like the liver or spleen. And stage V means it's in the blood or bone marrow.
Right. And I remember something about substages A and B.
Yes, that's really important too. Substage A means the dog isn't showing any systemic signs of illness. They feel relatively okay despite the cancer. Substage B means they are sick from the lymphoma, showing those signs like poor appetite, lethargy, weight loss.
And that affects prognosis.
Significantly. Substage B generally carries a worse prognosis than A, regardless of the stage number. So staging gives you that map of the disease's extent.
Okay, clear picture of staging. Now, let's talk treatment. What are the main approaches for canine lymphoma?
For the common, intermediate, and high-grade lymphomas, chemotherapy is really the cornerstone of treatment. Because lymphoma is usually systemic, you need a treatment that reaches the whole body.
Right, chemo drugs travel everywhere.
Exactly. Radiation therapy has a role, but it's more for localized issues. Maybe a lymph node that isn't shrinking with chemo, or a large mediastinal mass, or sometimes for specific skin lesions.
And surgery. You mentioned that's rare.
Very rare for lymphoma itself. Maybe if there's a GI mass causing an urgent blockage, or sometimes to remove a single lymph node that's resistant to other treatments, but it's not a primary approach.
What about things like bone marrow transplant?
That is an option, but it's quite specialized, intensive, and only available at certain referral centers. It's generally reserved for specific situations after achieving remission.
And supportive care must be important too.
Absolutely. Things like IV fluids if the dog is dehydrated or to help protect the kidneys during chemo, anti-nausea meds, appetite stimulants, managing side effects, and keeping the dog feeling well is key.
What's the most important message for owners when starting treatment?
I think it's crucial to understand that while we can often achieve really good remissions periods where the cancer isn't detectable and the dog feels great, canine lymphoma is usually not considered curable in the long run.
So managing it as a chronic disease in a way.
That's a good way to think about it. The goal is maximizing good quality of life for as long as possible. And the good news is most dogs tolerate chemotherapy remarkably well.
Better than people often expect.
Much better, typically. They don't usually lose all their hair except certain breeds. Side effects like tummy upset or temporary dips in blood counts are common, but usually manageable and reversible. Quality of life is paramount.
Okay. What specific chemo drugs are used? You mentioned combination protocols?
Yes, combination chemotherapy is generally the standard of care for intermediate and high-grade lymphoma, as it tends to be more effective than using just one drug.
Like the LCHOP protocol?
Exactly. LCHOP is probably the most common. It stands for L-asparaginase, vincristine, which starts with H in its brand name Oncovin, hence the H, cyclophosphamide, doxorubicin, also called hydroxydonorubicin, and prednisone.
That's quite a cocktail.
It is. Another common one is COP similar, but without the doxorubicin and L-asparaginase. Using just one of these drugs alone is possible, maybe just doxorubicin or CCN-ulomestine, but remission times are usually shorter.
And for these slower growing, low-grade lymphomas?
Treatment might be different, sometimes just chloramucil and prednisone taken orally at home, or maybe CCNU. The approach depends on the specific type and how the dog is doing. Consulting an oncologist is vital here.
Absolutely. Are there special precautions with these drugs?
Yes, definitely. Doxorubicin, for instance, can potentially affect the heart, so sometimes a protective drug called dexrazoxane is given with it, or vets might opt for a similar drug like epirubicin if there's heart disease.
Okay.
And doxorubicin must be given through a perfectly placed IV catheter because if it leaks out of the vein, it causes severe tissue damage.
Ouch. That sounds critical.
It is. And some drugs, like L-asparaginase and sometimes doxorubicin, carry a risk of allergic reaction. So pre-treatment with an antihistamine like dapsonhydrine is often standard practice.
Got it. What about managing side effects, or if the first protocol stops working?
Yeah, managing side effects is key. Since GI upset and low blood counts are common, vets will use anti-nausea meds, antidiarrheals as needed. Things like metronidazole, meropitant, ondansetron are common.
And if the lymphoma comes back or stops responding?
Then we talk about rescue protocols. There are many different combinations that can be tried protocols with names like MOPP or DMZ are examples. But again, this really requires specialist input from an oncologist to choose the best next step.
And follow-up is obviously key during all this.
Absolutely. Regular checkups, physical exams, blood work to monitor how the cancer is responding and to watch for side effects, especially low white blood cell counts, neutropenia. Chemo doses might need adjusting based on those counts.
What are the most common complications owners might see?
The big ones are usually that reversible drop in white blood cells, which can increase infection risk temporarily. Transient GI, upset vomiting or diarrhea, sometimes hair loss, but mainly in breeds like poodles or Old English sheepdogs, and potentially fever if the white count gets very low. But most are manageable.
Okay, so looking at the big picture, what's the typical course and prognosis? You mentioned good initial response rates.
Yes, that's the encouraging part. With multi-agent chemo like LCHOP, upwards of 80%, maybe even 90% of dogs with high-grade lymphoma will achieve remission initially, often quite quickly.
That's great, but remission duration varies.
It does. And that's where those prognostic factors really come in: stage, substage, AVSB, and importantly, immunophenotype BVST cell.
Right, so typical survival times.
For the most common type, high-grade multicentric B-cell lymphoma, treated with protocols like CHOP, the median survival time is generally around 12 to 14 months.
Okay, about a year to a bit over a year on average.
Yes. For high-grade T-cell lymphoma, unfortunately, it's generally shorter median survival, often quoted around 6 to 9 months. T-cell tends to be more aggressive or harder to treat.
That's a significant difference.
It is, but remember, those are medians. Some dogs do much better, some do worse. And for the indolent, low-grade lymphomas, survival can sometimes be measured in years, even with less intensive treatment.
Are there specific types with a generally poorer outlook?
Yes, unfortunately. GI lymphoma often carries a more guarded prognosis. Mediastinal lymphoma, particularly T-cell with high calcium, can be tough. And cutaneous lymphoma, especially mycosis fungoides, also tends to be more challenging and have shorter survival times generally.
This has been incredibly informative, really walking us through the complexity. So just to recap the main takeaways for everyone listening.
Sure, I think the key points are canine lymphoma is common, it's complex, with many different forms. Accurate diagnosis, including staging and typing, is absolutely crucial.
And treatment needs to be tailored.
Exactly. Tailored to the specific type, stage, and the individual dog. Early detection helps, so knowing the signs is important. And understanding the different types helps set realistic expectations.
And the single most important action item for an owner who's concerned.
Talk to your vet promptly. If lymphoma is suspected or diagnosed, getting input from a veterinary oncologist is really the best way to understand all the options and develop the most effective treatment plan for your dog.
Couldn't agree more. Okay, finally, let's leave our listeners with a thought to ponder. We know there are genetic links and similarities between human and canine lymphomas. So, thinking ahead.
What further insights, what breakthroughs in understanding and treatment for both species might come from continuing to study lymphoma in our dogs? It's a fascinating area where canine health and human health really intersect.
A great question to reflect on. Thank you so much for sharing all this expertise today. And thank you all for joining us for this deep dive.